diagnose mental illness by purely biological tests, and you can also, the way to cure mental illness is with a biological cure. So much so that there is now a firm touting a blood test for depression. So if you go to your local mental health counselor and you say, "Doctor, I feel depressed today," he'll say, "Wait a minute, let's draw some blood and I'll tell you whether you're depressed or not." Okay? That's what it means to have a biological test of depression, something that will be decisive about whether it's all in your head or someplace else. Okay, now that's interesting, except that it turns out that Warren and Marshall kind of jumped the gun here. A Japanese physician, Nomura, and his colleagues did this very interesting prospective study some years ago in which they took a group of patients who had gastric or duodenal ulcers, and another group of patients very, very, very closely matched who did not have gastric or duodenal ulcers, and looked in their guts for evidence of H. pylori. And what they found was that about 90% of patients with gastric ulcers had H. pylori infection. Almost 80% of ulcer-free patients also had evidence of H. pylori infection, okay? The implication of this is that H. pylori infection is not sufficient to produce ulcers. There has to be something else going on, which has led to a reformulation of the stress-ulcer connection in terms of what might be called a diathesis stress model for ulcers. This comes from Bruce Overmyer, an American psychologist, and Robert Murison, a Norwegian psychologist, who argues that stress alone will lead to the secretion of gastric acid into the stomach that will eventually erode the stomach lining and produce ulceration. The role of H. pylori is not to cause gastric ulceration. What H. pylori does is to increase the person's vulnerability to gastric acid. It's a diathesis factor that moderates or interacts with this kind of psychological stress, okay? So that there are actually two effective treatments for these ulcers. One is antibiotics, which attack the H. pylori, which increases vulnerability, or psychological treatments intending to go after stress reduction. So again, I talk about this battle about ulcers simply to make the point that first, there are reasonable reasons to think that psychological states such as stress, which are psychological states, can have effects on bodily functioning. And the second point is that this is a proposition that many physicians and others in the biomedical community find extraordinarily threatening. Okay? For those of you who are going to medical school, all right, I just want you to know what you're headed for. Most of you probably have seen Star Trek. You know that tricoder that Bones uses in Star Trek, where he kind of waves it over the patient and reads out a diagnosis, and then he waves it over the patient again and cures whatever it is that the person has. That is the ideal for certain kinds of medicine practice, where there's no contact between the person and between the doctor and the patient at all. It's all kind of done by machine. This is not necessarily the best way to practice medicine, but that's a subject for another course, I suppose. In any event, the idea that that there could be psychological causes for physical illnesses is something that bothers a lot of physicians quite a bit, and you can find the roots of this bother in debates about the relationship between body and mind. Let's look at another example of psychosomatic medicine for a moment, what has been called the jewel in the crown of psychosomatics, which are placebo effects of various kinds. Placebo is a treatment that is held out to be effective for various forms of mental illness, but which isn't in itself effective for various forms of illness, but which has an effect mediated solely by the patient's belief that he or she is getting an active treatment. That's what placebos are, and you can look in drug catalogs these days and actually find there are certain drug companies that will sell you pills that are actually labeled placebo. Okay, they don't have anything in them. They're capsules that have sugar or something like that. They are literally sugar pills. But there used to be a practice when a particularly recalcitrant patient would come to a physician, always having some kind of complaint. The physician would grab off his cabinet a bunch of pills and give them to the patient and say, these are just the right pills for you. Okay? Patient would take them and feel fine for a while. The pills were completely ineffective physiologically, but they had an effect based on the patient's belief. Well, it turns out that there are placebo effects, and the placebo effects in medicine have been best established in the treatment of pain, but they're around in other kinds of conditions as well. This is a very interesting property of placebos revealed by a study by the late Fred Evans, Australian psychologist working in America. Evans reviewed a whole host of studies of placebo-based trials of various kinds of pain relievers. And what he did was to calculate the amount of pain relief afforded to a patient by a placebo as a proportion of the amount of pain relief afforded to a patient by an actual analgesic drug. And what Evans found was that this is a constant. If the patient believes that he or she is getting morphine, the placebo is roughly 50% as effective as morphine. If the patient believes that he or she is getting Darvon, the placebo is roughly 50% as effective as Darvon. And going all the way down to placebo aspirin is 50% as effective as real aspirin. What's interesting about this is that the effect depends on the patient's belief about what drug he or she is taking. If you think you're taking morphine, you get a powerful placebo effect. If you think you're just taking aspirin, you don't get a powerful placebo effect, but it's still, you get about 50% of the bang that the real drug would give you. This, I think, is the no better illustration of the idea that it's the patient's belief that produces the pain relief, the belief about what drug the person is taking. There are lots of these studies around now. Evans also discovered that placebos have pharmacological properties that parallel those of the drug to which they're being compared. So, for example, the morphine is used for treatment of severe pain, okay? So placebo morphine is better in the treatment of severe pain. Dose response curve, that is how long it takes before how much effect you get per unit of drug taken. It turns out that if 2 pills of aspirin are better than 1, 2 placebo aspirin are also better than 1. The time effect curve is the same. If you're told that the drug is going to last for 4 hours, as you always are, when your doctor says to you, take 2 of these every 8 hours, you know exactly how long the effect is supposed to last, right? Okay? And so if your doctor gives you placebo and says take 2 of these every 8 hours, the placebo begins to wear off after about 8 hours. There are all sorts of these kinds of pharmacological properties that are really quite interesting, but they all are based on the patient's belief about what is going on. Even to the extent that placebos have certain kinds of cosmetic properties, what you might call. A large placebo pill is more effective than a small placebo pill. A dark-colored placebo pill is more effective than a brightly colored placebo pill. A bad tasting placebo pill is more effective than a good tasting placebo pill. A placebo delivered IV is more effective than a placebo delivered IM, which is more effective than a placebo delivered orally. Okay? The more apparatus, the more dangerous, I suppose, the delivery, the more powerful the placebo is. And it turns out that expensive placebos are more effective than cheap placebos. Here is a study done in Dan Ariely's laboratory where they gave people the placebo analgesic, one which was touted as a new high-priced analgesic agent, the other one as a cheap generic analgesic agent. And what you can see here is that the patients given the regular price analgesic got more pain relief than those who got the discounted price. Again, all of this begins with the patient's belief about what is going on. Again, it's the mental state that is producing the effect on the experience of pain. Moving to another area, there are a host of studies in the hypnosis literature where a hypnotic suggestion that certain things are going to happen will produce consequent effects on the body. The most interesting of these are what are known in the treatment of asthma as symptom provocation. Any of you who have asthma, okay, know that when you go in to find out asthma or any kind of allergy, know that when you go in to be tested by your physician, what he or she will do is actually try to induce an allergic reaction. Okay, that's how they find out what you're allergic to. Here is an interesting study by a British physician, classic study, Black, on the effect of hypnotic suggestion on what's known as the Mantoux reaction. This is a biological test for tuberculosis. It's a skin test. Don't see this too much anymore because we don't see too much tuberculosis anymore. But what you do is you inject under the skin a little bit of a derivative of the tuberculin, the bacillus, and if you've got tuberculosis, what you're going to see is a blister on the arm. What Black did was to take 4 patients who were Mantoux positive, that is, they had shown this blistering in response to the test. They all turned out to be these particular patients turned out to be highly hypnotizable, something I'll talk about later. And he simply gave them this suggestion: you'll no longer react to the injection as you did before. There will be no redness, no swelling, no heat, no itching, and no pain. And lo and behold, after the subjects got this suggestion, the swelling was almost undetectable, and the reddening was significantly reduced. So again, it's a suggestion. There was a belief here. Something is transmitted verbally, having some kind of physiological consequence. Now, there are limits to this. As Black himself discovered, it turned out that the underlying histology wasn't affected. The surface skin changes were affected by the hypnotic suggestion, but when you compared what was going on underneath the surface of the skin, there were no effects attributable to the hypnosis. So there are limits to this, but the point is that the belief about the patient's belief, the